All right, we're going to get started. Let's see. Urad said that the computers are not up for printing until Thursday. That's their hope. So if you did not print out an honor code form, you didn't fail yet. No, I'm just kidding. So if you could just run to the library and print one off and do that at a break, like in between your classes, and just slide it under my door, 616B, that would be great. If you have means to have it to me before class is over today, that's even better. But I do need to have it today. So anyway, just letting you know. They think the drilling is done, which I think was the noise that we were experiencing. So anyway, I think we're good. Are you guys, you want it the way I had it again, or you want it?
I can like the lights on.
Like the lights on? Is that better? Lights on?
Yes.
Like this?
Now, that's not to say at the end of the semester we'll want the lights on.
Yeah, I know. Yeah, I'm not an early morning person either, so here we go. All right. When we talk today about our national health picture, tell me what you think about and what you see as we talk about health and wellness. When you think of our national health, what comes to your mind? Obesity, okay. What else?
Aging population.
An aging population. There's a lot of people aging, absolutely. What else? Longer life expectancy. People are living longer. Hopefully they're living longer, healthier lives, not just living longer. That's important. What else? Yes?
I think it's more of a complacency issue. We're so used to getting things instantly and sent to our phone that we become complacent, and whenever things aren't convenient or they aren't easy, they feel out of normal, which exercise and doing anything active. I think it's more of a complacency.
Okay.
Overall.
And we want those instant results, don't we? And we don't always know what to do if we don't get them. Our chronic disease rates are soaring. We know that. Heart disease, still the #1 killer for both men and women. Obesity, diabetes. We're finding that diabetes is becoming one of our other epidemics out there, not only for us, but also for our children. All right, so when we see 10 and 11-year-olds that already have blood sugars in the 400s, we know something's wrong. There's something going on here that we need to fix. We know smoking rates are soaring, even though we have a lot of tobacco-free environments, grounds. I know many times smokers feel like we're really discriminating against them, but we have research that tells us it just doesn't help your health, you know. And so we really have tried hard to protect. But we have teen smoking. We know that the evidence shows us that if you smoke as a teen, your 50% likelihood of smoking as an adult is really increased. So that's a big deal. I don't know if men are driving women to do it, but women are smoking more than ever before. All right, and so that's also concerning. We also know that our chronic diseases, so many of them are preventable. And it's taken us such a long time to figure that out. I've taught this course for 15 years. And in the 15 years I've taught it, when we used to talk about prevention, people were like, yeah, we just don't have evidence that prevention works. Well, guess what? Today we do. And now people are starting to listen. Nurses have known that forever. Florence Nightingale knew that, all right? It's just taken us a long time to get the data and to convince people that prevention really does work. We know our lifestyle choices make a huge difference. That's one of the reasons you see us really focusing on our kids, trying to help them get healthy lifestyles. I remember watching my son when he was about 8 or 9. You know, he would have been very active and done lots of things, and then all of a sudden that video thing started, really coming around. And I remember him running next door and telling me, I'm going to go see if Garrett can play. And then he would run next door, and then he would be back in like 5 minutes. And I'm like, I said, you're going to play with Garrett? We are. I'm going upstairs. And I'm like, really? And so we have to look at a balance between that. We want our kids to be, able to do the video stuff and have fun and be savvy with technology. I don't think we have to worry about that. but we also want them to be active. We want them to just ride a bike on their video game. We want them to actually ride a bike. So many of the things that we can fix, we're trying to do that. So prevention is right there at the forefront, and you guys are going to be the nurses that are going to take that forward because you're the ones that are going to be out there doing that. The comment was made that we want convenience. I think we want health care like we want our coffee, all right? Some of you probably don't remember, but I remember the first drive-through pharmacy because I had a young child. And I was like, this is so awesome. I don't have to get out of the car to get my antibiotic for him after I've been to the doctor. I was like, this is just awesome. And then Starbucks came around, and we were like all excited because we had a place we could go get coffee. And then now we had a place we didn't have to get out of the car to go get coffee. We could just drive through, and they'll bring your latte to you. What a great idea, all right? I actually find myself sometimes looking for the drive-through if I'm in a hurry. I'm like, really, do I have to have a drive-through for coffee? And so when you really think about it, our health care is at our fingertips. We can do Dr. Google all day, right? I mean, we can find out what's out there. In fact, a lot of people don't come into the doctor or the nurse practitioner because they've done the Dr. Google thing and they're convinced they have cancer, or they're convinced they have, a disease that has no cure. Or it motivates them to come. That's the other part. We also have very educated patients, not always with the education we want them to have, but they come in with a lot of information. So we have to sift through what's good information and not so good. We also know that anywhere we go, there's clinics available. Those are going to be future places for you to work as a nurse practitioner if that's your goal, that you can work and do that. I mean, it's very hard for us to find any type of retail place today that doesn't have access to some type of health clinic. So then that really kind of leads us to think about how has health changed? Well, when we thought about health in the past, we really thought that it was the absence of disease. It really focused mostly on that physical piece of us. If you looked healthy, you're doing the things you're supposed to do, that you were healthy. Very big difference from today where we really look at more of a holistic view. Most of you probably have chosen nursing because you want to give that holistic approach. You want to take care of a person's spiritual needs, their social needs, as well as their physical needs, all right? And so that has really been something that nursing has embraced for many years. The World Health Organization really kind of helped to put it on the map. So now I want you to think about 4 different types of health models that are out there that really speak to the type of health that maybe you've had in your family, you've grown up with, or the type of health maybe you're going to practice. So the clinical model really deals mostly with the physical part. This is the part we a lot of times see nurses practice in the hospital setting, where they really don't have a lot of signs and symptoms of the disease. And if that patient looks like they're pretty well cured, they're sent home. All right? Now, does that still mean they don't have any care that's needed? Probably not. But that really focuses a lot on how they look and if they can do what they need to do. All right? So physical signs and symptoms. Preventative care in the clinical model is not as important. It's kind of like your car. Some of you know who you are. You drive your car. You know you're supposed to get the oil change. You know you're supposed to check the tires. You know there's something else under the hood they're supposed to do. But you're like, you know what? Until it's broken, I'm not fixing it. Okay? The unfortunate part is you don't get to choose when it breaks. So it breaks on the morning of a test, or it breaks on the morning of your first clinical. So maybe prevention would have been a good thing. Then there's some of you that you do all those things because you believe if I do those things, it's going to help to prevent me from having problems down the road. And so you kind of have to look at the whole picture. How many of you were raised in that kind of family where prevention wasn't practiced? You just went to the doctor when you were sick. How many of you feel like you had a lot of prevention? You went in for dental visits. You went in for dental cleanings. You went in for well child clinics. Even if that check was for a sports physical, you still went in for those kinds of things. So you have to remember, it's what you're used to is how you practice. So think about that. The clinical model is really focused more on signs and symptoms of disease, kind of more of that physical. Role performance has to do more with you're healthy as long as you can perform your social roles, all right? I would imagine for a lot of you, there was a lot of rejuggling those roles in the last few months when you got admitted to nursing school. There's probably going to be people picking up your children from school that you never thought would pick up your children from school. There's probably going to be people fixing dinner and doing laundry in your house that you never ever expected to do that in your house. But there was a shift of roles because you're not going to be able to do everything as you were before if you've been at home with your family. So your social roles are important. It's how you present yourself in society, how you present yourself to the people that you're around. So role performance has to do then more with if you can achieve those. Okay? Many times we say men focus under these roles because as long as they can get up and get to work, they consider themselves healthy. All right? And so that's important too. Adaptive model has to do with our flexibility. And if there's anything nurses are, it's flexible. And it's sure good because right now in the nursing college we have new construction going on. I just went down to the Learning Resource Center to see if anybody was even there anymore, and there's guys in hard hats that are tearing it up. All right, it's going to be beautiful, but the work has begun. There's many times when our classes get switched or our rooms get switched. So nursing has to be flexible. You will find it in the hospital setting as well. And so it really has to do with how adaptive we are. How do we adjust to that change? Many times, if we are really healthy and we're able to adapt to that change, we tend to do better. We're more flexible, so that's important. Many times, if we're rigid, we don't want to accept any kind of change, that becomes harder as well. So it's kind of that game of life where the only constant thing in life is change. So how we adapt really determines whether we're ahead of the game. Eudaimonistic. This is kind of a nice calming picture. Y'all probably maybe did some meditation before you came today, I don't know, or maybe this weekend. But it really has to do with our whole person. It's really looking at being the best we can be, but looking at all the pieces that play into that for us. It's more of an integrative model. It's our complementary therapies. It's the things that help us to really look at how do we manage stress, what keeps our balance as well. I have a balance rock paperweight on my desk that a friend gave me after she retired, and I said, you know, why are you giving that to me? And she said, because it's so hard to balance as we work and become a mom and do that. And I've had that rock now for 10 years, that little paperweight on my desk, and I always look at and remember that balance. The people I respect the most in my life are people that have balance. And that's really, really important, especially as nursing, because nursing draws you so much one way or the other. So now looking at those 4 different models, how many of you think you're more the clinical model? How many of you think you're more the role performance? How many of you are the adaptive model, or the flexibility? And how many of you feel like you're more the eudaimonistic? You kind of know when everything's not in sync, and maybe that's how you practice or try to practice. When you begin to go to the hospital and meet nurses out there that are practicing, start to think about what you see them doing and how they're practicing, what model they're using for themselves as well as for their patients. So let's just kind of make sure we're all on the same page. So the client who would be least likely to participate in health teaching activities would choose which of the models? Clinical, adaptive, role performance, or eudaimonistic? Which one would be most willing to really accept education and want to improve themselves? Yeah, it is least, but which of those would be the ones that would want more teaching? Which models? Adaptive? Probably. Role performance? Probably eudaimonistic? Yeah. So the one that would probably be the most resistant would be the clinical model. And so that would be the least likely one to participate. So then my question to you is there a difference between health and wellness? All right? It's kind of like which came first, the chicken or the egg, right? When we talk about health, we talk about things that are more passive, all right? When we talk about wellness, we talk about things that we can achieve. It's what we can do. It's how much better we can become. Nike's logo for many years has just said it. You know, I always kind of look at it and think, just do it. Don't worry so much about what you do. Just get off the couch and do something, you know. And so they're saying, just do it. Begin that way. So wellness has a lot to do with what we can achieve and what we can become. It's the lifestyle decisions that we begin to make at a very early age and how they affect us as we get older. I know a big one that we've seen change related to nutrition is I remember as a child hearing or thinking somewhere or somehow, well, you can eat it now because you're a kid, but as you get older, you won't be able to eat it. And now we try really, really hard not to teach that because we want kids to still have fun and do that. But we want them to realize that what they learn to eat and taste today is going to, you know, be something that carries them through. So we've seen a little bit of a different way of thinking there. When we talk then about people living longer, I think it's real interesting when you go and you look at the graph to see that in really the last 40 years, you've seen people that lived in the 1960s, if you go in the middle of the graph, they were living to 70s. But now if you look and you see how much farther we've come up, we are getting much closer to living in the 80s. And what I want you to understand is that isn't just trying to live as long as you can. That's hopefully having a productive, meaningful, healthy life as well. So quality is important, just like quantity. When we look at the quantity versus quality of life, what we really would like to carve out, this is what, if we had the magic formula and we could carve it out for you, is we would love for you, if you live close to 80, about 78, 79 years old, we would like for about 67 of those to be healthy, which would leave you to have about 11 or 12 years where you're going to have health conditions. And a lot of people say that's when you retire. That's why you retire, because then you need to go to the doctor, okay? And so a lot of people say that their retirement years is when they notice that. But how lucky for them if they can get to their retirement years, whatever those are today. Those are getting more and less in the same. We look at that they're not going to have half of their years to be unhealthy. And so that's the goal. That's what we would like, is that people would have no greater than 15 years, and the graph shows 11 to 12 years of their life that would be, you know, healthy, where they really wouldn't have a lot of health needs. And again, even in that impaired life, some of that is going to be related to aging. Our vision changes, our senses change, everything changes for us as we age. But what we do want to see is people that are living longer, healthier lives, and we are starting to see that. So then when we talk about the wellness continuum, what we're really talking about are all the dimensions of wellness. So I want you to start to think about now what part of your lives are really good and what part of your lives could use some assistance. And that's what's going to help you to work towards your wellness contract and your wellness goal. So when you look at the left side, you see a lower level of wellness. Okay, that does not mean that you're horrible or you're going to die tomorrow or whatever. All that means is that your wellness could be improved. Those of you that are already over here, maybe some of you are avid workout people that are at the gym all the time. You do marathons, you do triathlons. Maybe some of you just enjoy exercising. Imagine that, right? That you enjoy exercising. What it really shows us is our wellness level can always increase. We can always be better and more. It's just our goals are going to change depending upon where we're at and what we're trying to achieve. So when we look at the dimensions of wellness, I think one of the first ones that we think about is physical. It's our fitness level and how we care for ourselves. And really, what drives us to improve that dimension of wellness is because we want to look better. But what we really are going to achieve is being healthier overall. And that's really what we want. We want to maintain that flexibility throughout our life. You know, life's no fun if you can't tie your shoes, you know. And we want to be able to be the best we can. Our emotional level, how are we with our feelings? Are we able to communicate? Do we understand? Can we deal with our feelings? You know, if we have loss, if we have loneliness, if we have anxiety, all of those things, how do we deal with that? Our intellectual ability, you're probably really concerned about that. You want to make sure your mind is healthy and that it can perform at the level it needs to become a registered nurse. You know, that's going to be really important to be able to think on your feet. Can you find solutions? Can you improve that? How can you improve your intellectual health? First thing you can do is get sleep. We know that. Research tells us that people that don't sleep, there's a lot of other things that follow from that. Interpersonal. Do you have good communication skills? Do you have relationships? You know, your relationships are probably going to be strained in some way right now because you're not going to have a lot of extra time to spend with friends and do social things. Even though we still want you to do some of that, you're going to probably feel a little guilty when you do it because you feel like I should be studying. But that spending time with your family, your friends, doing some social things actually helps you do better. I know it's such a hard thing to remember, and when we're in school, we always think every minute needs to be spent studying. But there are other things that help that study time to be more productive. Our spiritual dimension, that can be principles, values that give our meaning and purpose to life. That may not always be a religious thing that you're thinking of. It could be other things that are a part of your life. For a lot of people, organized religion falls into that category, but that may not be for you. So it's whatever helps to give your life meaning and purpose. Environmental, looking at your surroundings. You know, are they livable? Are they clean? Are they ones that are not going to give you a lot of work hazards? And that's going to be important as you choose your nursing career. Where are you going to choose to work? You know, an oncology nurse that's going to be working with chemo drugs on a daily basis is going to have to be really careful, follow the guidelines for safety for that. A radiology tech, you know, there's going to be hazards to the type of things that they're exposed to. So there's a lot of environmental issues that you want to think about. Financial is the newer one that's been added. It's the seventh dimension. We used to have 6, and now we have 7. Looking at not only economically, but also what's fulfilling, what helps us. We know money sure helps. You all chose nursing because you want to be here and you want to help people and you want to learn about it and you're interested in the science and the art of nursing. But it doesn't hurt that it pays a nice salary. And so that's important too. Some of you have very lofty goals that you want to continue on into being a nurse practitioner, a CRNA. There's a lot of things that you can do in nursing. And so those are all things that hopefully are going to help you. But also being able to manage your money, being able to find that balance so that you feel at peace with that as well. Occupational wellness is a newer one. It has been talked about. It's not added as a dimension of wellness yet, but it's one that we talk about, and that's really just being satisfied with what we do. I'm very blessed to work with people that are here that probably could have retired 10 years ago, and they're still here. Now, you know, for everybody, that's not what they want to do. I don't know how many years I want to be here, but I love being here, and I love what I do. And I think that's what's really important. There's a lot of people in the college that you're going to work with that maybe don't have to be here anymore, but they still love it, and they want to be here. And so I think we have to look at where does our passion come from, and I hope that you find that as well. So then, what is health promotion then? You know, when you think about health promotion, you think about promoting health. It's helping people to realize what their true potential is, making them aware of what their health could be. And so we're really looking at interventions that help to improve not only individuals, but groups or communities. And we're going to focus a lot in this course on individuals and small groups and promoting health. When you get to your last semester and you're focusing on community health, you're going to be focusing on populations and communities. You're going to be looking at different zip codes and figuring out where are pregnancy rates higher, where are immunization rates lower, and what do we need to target for those types of neighborhoods. And so nursing does what we call a windshield survey, where we drive around and we actually can survey the type of health needs just based upon the zip code they live in and then what we see in the way of a neighborhood. So lots of differences that can happen. We also talk about health promotion versus health protection. So health promotion is really helping people to change their behavior and targeting interventions to do that. Health protection is protecting groups of people. So your car seat laws, your Food and Drug Administration regulations, when you get a warning out that says we've found listeria or we've found staph or we've found E. coli or something, and maybe they're pulling and recalling all kinds of things. Bluebell knows that all too well. Those are things that protect us. They help to protect groups of people, so we know. And so those are things that we know need to happen. And there's certain regulations, certain laws that are put in place that give us guidelines to protect people as well. We also know that prevention can be other tools. It's not only diet and exercise and wearing seat belts. We encourage people to get their flu shots. That has to do with prevention. We also encourage people to do early screening, high blood pressure, diabetes checks, cancer detection if they have history, those kinds of things. We also know that people that have a risk of having heart disease and a high cholesterol, we may start them on some of the statin medications or some of the cholesterol-lowering medications early on. And that's really a preventative. We want to prevent them from having a heart attack or having one later in life. So there's some prevention issues there. So it's not always just teaching people how to be heart healthy. There may be some mechanisms that we put in place to help with that. Tamoxifen to help prevent breast cancer, a medication that people that are at high risk for breast cancer or in early stages of breast cancer can take. It's been a clinical trial for many years, and now it's a pretty established drug therapy that we use. So there are lots of ways that we can prevent disease. But the type of prevention has to do with when it happens. So primary prevention is the first level of the three there are. So we talked about health promotion, we talked about health protection, and now we're jumping to prevention levels, right? So there's three prevention levels. Primary prevention has to do with preventing disease before it ever occurs. So that's when we get the group together and we talk to them about, let's prevent you from having a heart attack. Do you know if you're at risk for a heart attack? Do you know if you're at risk for diabetes? So we're going to prevent the disease or injury, hopefully, from ever occurring. So we're going to give them information so they become more informed as consumers. Secondary prevention has to do with detecting the disease early on. Most of the time we do that through screening. You take a blood pressure. You're going to work really hard to learn how to take blood pressures this first half of the semester. And you're going to feel so good when you actually get the numbers right. And then you're going to have to figure out what do the numbers mean. So once you get the numbers and you can actually hear what you're supposed to hear, then you're going to have to look at it. You're going to have to talk to someone if the numbers are high. We usually say if they get a reading on 2 occasions, different separate occasions, and it's elevated, we need to do some follow-up screening with them. So much for the drilling being done, huh? So the early diagnosis is really in that early disease state. Maybe we do blood pressure and blood glucose screenings, and their blood sugar is high. Well, it's really nice for us to know that. They've had 1 or 2 blood sugars that have been high, so now we can talk to them about eating and their chances of diabetes if we don't lower that, and so what we can do. So it's really early detection so that we can do prompt treatment, because the earlier we detect, the sooner we can help them to hopefully have a better outcome. You notice that teaching is also listed on secondary, and we talked about teaching under primary. The only thing that I just want to emphasize there is that teaching is probably going to happen at every level, but the way we teach and how we teach and our emphasis is going to change. So if you're teaching someone not to get diabetes, or you're teaching someone that has a high glucose level in secondary, you can probably see that your teaching emphasis is going to change a little bit. Tertiary prevention means then that we're trying to return someone to their rehab state the best we can. So now they have the diabetes or they've had the heart attack. It's hard for us to take that away, but we really still want them to have a good quality life. So we want to figure out how can we work with them and have a good outcome. So we're restoring, rehabilitating. We can't take the disease or chronic condition away, but we can hopefully maximize their life so they can still have good quality life as well. And so that's physical caregiving, resources, all the things that we would do to help return them to a level that's the best we can after their disease. All right, so primary, prevent the disease from ever occurring. Secondary, early diagnosis, early detection. And then tertiary, restoring and rehabilitating, all right? All right, so the nurse is teaching about primary prevention and includes which educational statement in the instructions? A, everyone should participate in colorectal cancer screening. B, health teaching about the risk factors of heart disease should be performed. C, limiting disability is a vital role of nursing since preventive measures are therapeutic. And D, the nurse is involved in minimizing the effects of disease and disability by surveillance and maintenance. Okay, so which of those can you eliminate? Somebody said A. Why could you eliminate A? Okay, because you're really looking more at early detection. So A can go. What else can go? D, the nurse is involved in minimizing the effects of disease, because that's which level? Tertiary. And so what about B and C? B would be the answer. Yeah, because C has to do more with tertiary again, limiting disability, so B is the correct answer. Health teaching about the risk factors of heart disease should be performed. All right? So as you begin to study and think about the prevention levels and health promotion versus health protection, think about not only the definition, but then how could we assess that in a patient and what would be different about them. When we talk about wellness as a nation, we've already talked about how prevention has really kind of become the forefront. It's one of those things that we're really looking at. Healthy People is really the national initiative that we have in place to help us really achieve our goals. And so I've given you the website, thehealthypeople.gov, and when you click on that website, if you look at the notes, you will be able to go to, well, not this one. It does work, but not here. You will be able to go to the website that talks about healthypeople.gov, and it will give you information about how the Healthy People organization was started, the vision, the mission, the goals for the organization, as well as where we're at tracking, as well as where we are. So this was one of those national objectives that was started in 1979. We redraft a new set of goals every 10 years, so we're working right now on the 2020 goals, and once those are done, then we'll be working on the 10 years out from there. And it really is a report card on how our nation is doing with their health. And Healthy People is something that you're going to hear about all the way through the nursing program. We're going to talk about it related to all the different things we try to do for med-surg clients, for kids, for women and babies, everybody. And so it's one of those things that you want to make sure you know about. So when we look at the 4 overarching goals for Healthy People 2020, what we're really looking at is we want people to have high quality, longer living lives. All right? So we know we want people to live lives longer, but we want them to be able to do so at a higher quality. Limit disparities. We want there to be good health for all. In other words, we want to have environments that promote good health for everyone, from the young to the old. And we also want to make sure that those behaviors carry on throughout their lifespan. So higher quality lives, reduce the amount of disparities, good health, and then make sure it goes across the lifespan. That's kind of really the main goals for where we're striving. Some of the new topic areas that have been added to Healthy People 2020, and when you go to that website, you will see some of these added, have to do with adolescent health, knowing that our teens are having diseases, or more our teens are having babies, having sexually transmitted infections, so there's a lot of things that plays a role. Looking at early and middle childhood and the value in prevention over a person's lifelong life. Genomics, the influence there, diseases with risk factors, global health, not only what we're doing here, but what we're doing across the globe, And then also looking at our quality of life and how that makes a difference in the type of gender that you choose to spend your life with, lesbian, gay, bisexual, transgender health, and we've heard a lot more about that in the news lately anyway with some of the people that have assumed those lifestyles. Healthcare-associated infections, older adults. We hear a lot more about dementia, Alzheimer's. We hear a lot more about memory care centers. It's not very hard for you to talk to someone for very long to find out that they know someone that has Alzheimer's, or they're looking for a memory care center. They can put someone in that just recently been diagnosed. So all of those. How prepared are we? How prepared are we for natural disaster? How prepared are we for the influx of vaccinations that may or may not be out there for some of the diseases that we're finding? Sleep health, that's probably one of the biggest ones. It's probably one of the biggest ones out there today is the value of sleep and overall well-being. If I tell you anything today before you leave, it's that you still need to sleep. And you're going to look at everything we assign to you and say, how do they expect us to sleep with all this other stuff? But we are really finding a lot of research out there. Social determinants of health, really looking at what plays a role in choosing that. So those are some of the newer topic areas, and I know when we get to the next set of rules and next set of goals, we will find a lot more just because they're there and coming. Leading health indicators are different from the new topic areas. So we have healthy people as an umbrella, we have the vision, we have the mission, and we have the main goals. Those are all things you need to be familiar with. Then we go into new areas, the topic areas I just talked about. Then we go into health indicators, so that's another layer. Those are high priority issues. So making sure people have access to care. The Clinical Preventative Services web link I've given you is a web link that takes you to guidelines for people. It tells you for a 4-year-old, these are the prevention, screening, education that they need. This is what a 10-year-old needs. So those Clinical Preventative Services help to make sure that every age, every gender, every type of person is getting the same amount of care, the same that's provided to them. So if a mom is taking her 3-year-old to a North Dallas clinic, and another mom is taking her child to a Southwest Fort Worth clinic, the Clinical Preventative Service guidelines should be followed by the practitioner so that they're getting the same information. How it's delivered will be very different from practitioner to clinic. But we should still be looking at the same guidelines as our umbrella to help know how to treat them. So that's kind of how the Clinical Preventative Services lay out. We're going to talk about those more as we move through the course, but I'm just wanting you to know they're there today, and as we move forward, you'll talk about them more. Environmental quality, injury, and violence. We put a lot of emphasis on maternal, infant, and child health. A big one there is breastfeeding. Being able to now say we have research that supports breastfeeding, especially for preterm infants, and why the value is just huge. Mental health, looking at lots of the different mental health disorders. Oral health, with increased gum and oral cancers. We want to make sure that we look at that. So those are things that are there. Reproductive and sexual health, nutrition, physical activity, and obesity across the lifespan, obviously. Substance abuse, tobacco, looking at all those things and how they relate to your overall health picture. So now I want you to think for a minute about where you're headed with your health, okay? If you are over here, awesome, pat yourself on the back. What our goal for you is to stay here, all right? Not to slip down too much. If you're one of those people that's like, oh, there's me, I'm the doom and gloom at the other end. I'm like, I don't eat right. I don't really like to exercise. I really care less about my mental, emotional, and social or whatever health. Maybe that's you. So you're at the opposite end. Hopefully not, all right? But what we want to do is turn that doom and gloom into you being able to achieve a better health for yourself. So the environment makes a big difference. Many of you may ride this wellness roller coaster. Even if you don't like roller coasters, you may be on one where you get really pumped up after the first of the year and you're ready to start a new semester and you're like, I'm going to eat right, I'm going to go to the gym, I'm going to do everything right, and you do that really well for a while, and then all of a sudden the roller coaster takes a dive, okay? And we all know it's really hard to get back in the seat on that roller coaster once you take it up, right? And what I want you to remember is how good, well, if you don't like a roller coaster, you're not going to like this analogy, how good you felt at the top. So why do we not stay at the top if it feels so good when we're doing everything we're supposed to be doing? We're going to the gym or we're walking and we're watching what we eat. Why do we dive down if we like the results and how it feels when we're at the top? Yes?
Life circumstances.
Yeah, life happens, doesn't it? Yeah. There's a lot of temptations out there. The world doesn't cooperate with us. Some of you that have roommates may try to go on a diet or a lifestyle change. And how dare your roommate buy cookies, you know? Don't you know that if I'm on a diet, everybody else needs to be on a diet? If only the world would cooperate with us. So life happens. So as you start to work and think about yourself, remember your patients are going to think about that too. So how to change then? Well, you've got to get serious about your health. Well, I mean, yeah, that sounds real easy, get serious. You've really got to look at your habits. If you're having trouble looking at your habits, if you're fortunate enough to be one of those people that can't find anything you want to change, then talk to the people around you. I bet they can find something for you to think about. Talk with your family and friends. Be really careful with that, though, and pick who you talk to, because you don't want to mend in, you don't want to mend if they're the ones picking up your kids while you're in nursing school, you really want to be careful, okay? Because they may say, well, I think you should do this, and you may not agree. So that needs to be someone that you develop trust with and you feel comfortable with. Target one specific behavior. There's a couple of wellness surveys, profiles, and a lifestyle evaluation that just kind of helps you. That's in the Thank You book. There's a digital version. There's a print version that kind of helps you think through it. Even if you don't do it, it might give you a place to start to think about where am I at in my health and what do I want to do. And my main thing I want to emphasize for you is to keep it simple, all right? Because if you keep it simple, it's so much easier to be attained than if you don't, all right? So if you take on too much, it's going to be hard to do it. Think about the pros and cons of change. Maybe you're one of those people that's like, you know, the one thing I would like to do is lose a little weight, but realistically, this is not the time. Change involves commitment. So you being able to say, I want to do this right now, but I just don't think I can do it right now, but I'm going to do this. Instead, I'm going to start walking a couple times a week because that's going to be a good thing towards that goal someday. That's perfect. We know sometimes there are better times to change than others, and you've just taken on a huge commitment to come into nursing school. So this may not be the time to make a total transformation, all right? But we also want you to be able to take steps towards better health. Think about the cost. Think about how can I convince myself that I can do this. There's a reason Weight Watchers, Jenny Craig, Slim for Life, all those places are going to be in business for a long time because people never get it on the first try, all right? And lucky for them, we pay them money each time we try, right? So they stay in business and we learn about ourselves. We either learn that wasn't the right approach or what we need to do next time. So what is it you can do to help yourself think about whether you can do it or not? Probably the most important thing on this whole slide, other than change, is the word barriers. Because even though we talk to people all the time about how much better their health will be as if they make this change, what's the one thing you were all telling me when we were just already talking about it? Life happens. So all the things that prevent you from doing it are what you're going to think about first. Yeah, I know I'd be healthier, and I know I would live longer, and I know I'd be better for my kids. But let me show you my schedule, all right? Well, let me show you their schedule, all right? Let me show you our checking account, all right? Those are the things sometimes that are barriers, and those are what people think of first before what's good. So I always say, let's talk about what's keeping you from doing it. And once we start to talk about that, we can sometimes then whittle away a little piece of it that hopefully takes into account those barriers. So really the barriers shouldn't be on the bottom, they should be on the top. Because research tells us people look at barriers sooner than they look at benefits. All right? Motivation is what gets you started. Habit is what keeps you going, all right? So you're motivated to look good in that dress for that wedding, right? Sometimes that's our motivation. That's a lot of times a women's motivation, all right? We don't always think about our health. Maybe it's kind of in there, but we really, the physical part. But you know what? If that's what gets you started, that's not a bad deal. But you got to somehow figure out what's going to keep you going, okay? How long does it take to develop a new habit? 21 days. Now that isn't that you pay for the gym membership and 3 weeks later you have a habit, right? That's that you actually participate in that new behavior for 21 days, and it starts to feel like it. And that's happened to all of you. You've either started riding a bike or walking or going to the gym or eating better, and after a while, you kind of feel bad when you do the other stuff because it's become a part of you. Those of you that are successful in going to the exercising and doing all of that probably know that. You just feel better when you go. It's a part of you. Are you ready to change? Lots of phases of change. I don't expect you to know all of them. I just want you to know that there's phases of change that occur. The first one, you know about it, but you have no intention of changing. All right, some of you are there. Contemplation. Yeah, in the next 6 months I'll probably try to do that. Preparation, they're getting much more serious. Within the next month I want to start to think about how I can change. Action, that's when you're actually doing it. Most people would tell you the hardest part is this, the maintenance. I lost the weight, I started exercising, now I've achieved my goal, why do I need to quit doing it, keep doing it? Oh yeah, because in order to keep my goal, I have to. So those are the things that are sometimes the hardest part. And then termination, you really are past that lapse period where you really feel like this is something that's new for you and it's going to stick. The stages of change can be a spiral model that goes up, but it also can be one that comes down. So your wellness contract looks a little bit different than this one, but this one was the one that's in the book, so I wanted to just show you it. You're going to start to think about a behavior that you want to change. All right? Some of you already know what that is. 2 things, you're going to think about how can I achieve it, what are the barriers, and I got to keep it simple. All right? So if you tell me I'm going to go to the gym 1 day a week, I'm not going to send it back to you and say this isn't enough. I'm going to be like, yes, this sounds like a goal you can achieve. If you are a couch potato, you have not exercised all summer, or maybe even all spring, or even since last Christmas, and you're telling me you're going to go to the gym 5 days a week when you're starting a new nursing program, I'm probably going to say to you, are you sure? All right? So set up a goal that's realistic and achievable. You'll feel so much better that you achieved it and went beyond it, if that happens, than that you fell short and couldn't even get to the gym one time. All right? So